Good afternoon, everybody. I'm David Baiada, the CEO here at Baiada Home Healthcare, and today is Friday, March 12th, and this is your weekly COVID-19 update. There's a lot happening out in the community, and on one hand, there's still difficulty in accessing vaccinations. There's uncertainty about what's safe and what's not. There's still a lot of clients and employees here at Baiada that are worried and anxious about safety. And at the same time, the world seems to be opening up, right? Restaurants are opening, schools are going to go back in session, things are happening. And so we're in a bit of limbo here, which requires continued focus on ensuring we understand the facts, we understand protocol, and we do everything by the book. And so I'm going to turn over to Nora as usual, who will focus a message today on in this environment where things seem to be moving and adjusting and changing, what hasn't changed? Nora?
Thanks, David. And I'd first like to start with there, as David says, there's a lot of activity because a year ago today, we started down the road and the World Health Organization determined that we had a pandemic, and we've come a long way in that pandemic, and we continue to learn from the science. And so we have things happening in the community, and yet we have more of what is the same in the clinical scenario. So we still have a public health emergency, and so we still have the same guidance for you to follow. We're asking you to continue to remain vigilant and to wear your surgical mask and your eye protection during all client interactions. It's really easy to think, well, I go to this house all the time, I'm just going to take off my face shield. Please don't do that. There's variants out there. There are reasons that the CDC has not told us yet to take these off, so please wear them. If you're caring for a COVID positive client, make sure you're wearing all the necessary N95s and other appropriate equipment. Also, make sure when we're caring for aerosol generating procedures and clients that have those kind of necessary procedures that we are getting fit tested and wearing the N95. And pay attention to your screening. Some of these you've been doing for a year continuously. It gets to the point where you think, well, maybe I can just let up a little on those. Those 4 bullet points are really important. So make sure you're doing all that. And then staying tuned, as I know many of you are, checking out the CDC. On the right-hand side of the slide is the latest guidance from the CDC and talking about what you can do in your personal life and out in the community. And again, I highlight the point, there's been a lot of questions about travel. And the CDC is really asking us to delay domestic and international travel. But if you do, then you really have to pay attention to the requirements and the recommendations for quarantining when you come back to your state. So just some news from the CDC. We anticipate, that just like a year ago, we had real updates every couple of days about what was changing with the CDC. We're sort of on the other side now, and we're going to be seeing real frequent updates about how we can continue to lighten some of these requirements up and return more to normal, because we're getting almost 3 million individuals vaccinated across the country every day. So if you, again, haven't gotten your vaccine, please look for a spot to be able to get your shot and continue to practice the other safety measures. Keep yourselves, our clients safe. We're almost through this. I'm so proud of everything you've done. Just a little bit longer, a little bit of patience, we'll get there.
Thanks, Nora. And as usual, I want to conclude with some recognition of some of the amazing work that's going on out there in the community with our clinicians. This one in the state of New York, where one of our clients was actually interviewed by the Bronx Times. She was COVID positive and shared that My home health aide has a plan for everything. She makes sure it's a balanced meal for breakfast. She's the best. Without Miriam, I don't know where I would be. Baiada has helped me so much. Thanks, Miriam. Thanks to your client Rosa for recognizing your incredible support of her needs through a really complicated time. And thanks to each and every one of you. Miriam's really just the embodiment or the representation of everything that all of you are doing every day. And it's inspiring. So thank you. We'll see you next week.